Hi, everyone. Happy Monday. Thank you for joining me here. Today, I'm super excited to interview Olivia Zarek. She is the happy, proud owner and registered massage therapist of Midas Touch Therapy, Inc. Honestly, for myself, she is my personal massage therapist. She has changed my entire life. I definitely have some challenging areas, me constantly driving, but for sure, I wouldn't be able to do it without her. So if you're experiencing aches and pains or stiffness, let me introduce you to one of the most unbelievable business professionals I've ever met, Olivia. With that said, she does work a little bit different than most massage therapists. I've seen quite a few. I've never experienced one like her. So, with no further ado, kindly help me introduce Olivia. Hi, Olivia. Thank you so much for joining us here.
Good morning, Chaunyce. How are you today?
I'm doing great.
Fantastic.
Thank you. Will you tell us, what do you do?
I am a registered massage therapist and acupuncture practitioner, and I'm self-employed and run a private practice from home and have been running a private practice from home for the last few years, but have been a registered therapist for approximately 17 years.
Okay. Can you expand on that? Because I have personally experienced you, and it's my joy to experience you. But I find that you don't really work like any regular massage therapist I've ever experienced.
I take that as a compliment. Yeah, you know what? A lot of what I do is very unorthodox. It is considered deep tissue massage. I practice under the realm of Swedish techniques because that's what I was taught. However, over the years, I kind of created my own formula and ways to treat people that I found to be far more effective than just your standard massage. I had continued a lot of education units as I had become a practitioner, acupuncture being one of them, which I went to McMaster University for. And I found it to be extremely effective in treating trigger points and certain other things. Also, along the way, I took Graston, which is also another program which breaks down scar tissue beneath the skin, basically using surgical steel metal tools to break down adhesions beneath the surface of the skin. Then I also had integrated shockwave therapy, which can also be used for things like plantar fasciitis or breaking down post-surgical scar tissue. I had managed to pick up a lot of these tools or decide to go to school for these tools. These modalities I had in turn adopted or learned or went back to school for over the years. Because I found it to be extremely effective. I had learned some from some practitioners, some I had gone back to school for, taken other programs. So I kind of devised my own formula under my license, which is completely within the scope of our practice. And we're allowed to do that. It just happens to be the case that a lot of therapists are either too busy, overwhelmed with work, that they don't have the time to go and get these tools. I fortunately was able to devise time, like allocate time to go to school and learn from other practitioners over the years.
Perfect. So, with that being said, can we talk about it? When I come to you, often I'm like, one, my neck is really out of sorts. My lower back is having issues. Sometimes it's my hips or my elbow. Like I'm all over the place. And what would be your course of treatment for me when we do the procedure, the massage?
So firstly, I generally assess a person, even when they're walking up the hallway, to see some of their imbalances. Sometimes I can notice that a hip might be jutting slightly more forward, or a shoulder might be off compared to the other side. Sometimes someone's just pulled anterior forward, or sometimes it's just simply their bodies being on the table. One of the things I've learned over the years that, and this is why my room is fairly well lit with daylight, is that the body casts shadows. Where there's muscular imbalances, it almost looks like hills and valleys of a field, if you will, as the sun begins to, cast, or when it's going down. So it really highlights the imbalances for me, almost like an imperfection on your wall. If you notice your light overhead and you're like, oh my God, a drywall screw is popping out. Well, it's so much so that way for me when a person is face down. I get to observe the imbalances and see what's going on. One side might seem to be a little more prevalent than the other, that there's issues going on, or it might be an indication that something's really not going on the other side. And that's where my hands are, kind of require the skill to be able to go in there and palpate and, okay, wait, is it the side that looks horrible, or is that side actually healthy in comparison to the other? Sometimes there's more nerve firing to tissue. So you have to be able to distinguish what the actual issue is. So in a patient case like yours, I generally watch you walk up the hallway. I have you lay down on the table for me. That's what's going on. So I will look at your back, for instance, and be like, hey, is the skin moving nicely over the muscle, or is it not? Does one particular, let's say the right side of the trapezius muscle feel tighter than the left? You're able to feel certain things. Sometimes I might be pushing down on one certain area of the muscle, and something can be twitching down in the low back, which is an indication that something's going on. So a lot of what I do is observation and deciding what I feel the best modality will be to apply to you. I always refer to myself as the one-stop shop, and maybe that's the wrong way to refer to myself, but a lot of the modalities I practice also include physio alongside of it. So shockwave generally is applied as a physio tool versus a massage therapy tool. However, I find it to be extremely effective and useful, hence why I've integrated it into everyday practice for myself, because I know my patients will benefit the most from it. Much like electro acupuncture, similar to just standard acupuncture. However, electro, that's the key, that's the difference, is that I add electricity to the needles, whether by 15-20 second stimulation, or I'm doing a low stimulation of 10 hertz or 9 hertz rather, for a 15 or 20 minute interval during treatment while I work on something else. Electro acupuncture is kind of like going down your sidewalk multiple times with a shovel versus just creating one path, dragging it one time. The electro acupuncture is almost like having multiple treatments in one. It's extremely effective. The central nervous system has this incredible ability to adapt and to change the signal to the tissue once I remove the needles. So let's say your muscle wants to tighten up again after treatment. You might feel this weird fasciculation, or almost like a twitch rather. And you're like, what's going on? And in fact, that's your body wanting to tighten back up. But that twitch is muscle memory stored from the electro acupuncture, sending back a signal to the brain saying, hey, I'm healthy. There's nothing wrong with me here. So you're like, oh my God, is it normal to be twitching? It's completely normal to twitch after treatment. These are just all the tools that I've managed to, transfer into my practice and include under my umbrella. So yeah, that's kind of what I do.
Well, thank you for everything you do, because there is a plethora. Can you tell me, it's very clear that you're super passionate about this.
I love it.
What made you get into this industry?
You know what? Truthfully, I had initially gone to school for psychology, and I had realized quickly through my second year that it wasn't for me. Kind of like how do the blind lead the blind, right? Especially at that age, at 21, really, what do you know? And societal pressures. I was like, hey, this is not for me. And I remember sitting there one day with my sister, and she's like, "Oh, come rub my shoulders," as I was telling her I was going to drop out of school. And she goes, "Oh my God, Mom and Dad are going to be so upset with you." I'm like. Really? So as I was rubbing her shoulders, she was, "That's it. You're going to go to school for massage therapy." And so, it was at that point I had gone to CCMH and opted to do a compressed program. So it's where they take a 3-year program and they jam it into 18 months. And although most people say, "Oh, it's a lot of learning. It's a lot of education to cram into a very short period of time," because you're dissecting the human body. And this is where a lot of people don't realize, as part of our program as RMTs to get registered, is that you're learning everything down to the microscopic level, the cellular level of the tissue. It's not just, oh, they know the muscles, they know the anatomy, we know the neuro, we know the physiology, we learn pathologies. And I don't have to transfer you from practitioner to practitioner. Hence why I do all the modalities myself. That way I know the right shoulder's definitely treated, or the left glute has definitely been taken care of. It's not being passed off to other practitioners to do the work, which not that you don't trust the system. It's just I'm a control freak and I want to make sure it's done correctly to the right structures of my patient. So that's kind of what I do and why I do it. Like I honestly just want people to feel better. And that's it.
Well, with myself being one of your patients, the next question I usually ask you, but I'll answer it myself. The next question is, what do your clients like the best or love the best about your business? What I love the best about coming to you is literally every single time you've treated me, I leave. Don't get me wrong. I'm in pain because you really do get in there. But every single time without fail, I have left. Yeah. And I feel like my entire body, she gives me like a brand new body. Like I have a new neck, I have a new back, because she literally works out what the issues were. And I'm like, oh, look at that. Like my neck works again. That's what I'm just so grateful. Thank you so much for what you do.
You're so welcome. Thank you for trusting me with your care. You know, regardless of advancing technologies, I tell people we only have one body. You can't just replace parts. So anytime anybody walks through my door and trusts me with their care, it's a big deal. You don't take that lightly. It's not to mention the vulnerability of a person who becomes more than half naked on your table. You know, so there's a certain amount of respect and appreciation for the trust that's given to me. And so I've always upheld my job and what I do, my career, with the utmost dignity, because this is a very vulnerable position for anybody to be in. That Chaunyce, you do feel sore for a few days when you leave here, and again, it's pain with purpose. I am going to hurt you. It's going to suck. You might even be bruised. But in the end, we know it works. Mm-hmm. My biggest payload is being able to assist, to facilitate healing. Your body essentially is doing it all for you. I'm just beating it up to get to the point to do what we needed to do, to respond the way we needed to. So that's what I do.
Can you tell me, how do people get a hold of you?
You can text me, which is also the best way people try to also get a hold of me. On my cell number, believe it or not, it's my business cell. So at 647-290-0996. Or you can send me an email to Midas Touch Therapy 2006@gmail.com. Yeah, that's pretty well it. Or of course, once you have Instagram, I'm Midas Touch Therapy 82. So
amazing. Is there anything else that we didn't cover that you wish people would know that for some reason traditionally they don't?
Not necessarily, but I will leave you off with this, is that as much as we'd like to think, oh, well, I'm already going for therapy, and people a lot of times almost feel hopeless, especially if they have pain or they have underlying issues, or not people with underlying issues. And because they've already trusted other therapists to take care of things, don't give up hope. Don't give up faith. There are therapists out there like myself who know what they're doing, who genuinely do care, and will be able to get to the bottom of your issues and give you 100% of their efforts to help heal you, to help facilitate healing. It's not that the other therapists aren't trying. You need to find one who can manage to do it, because it's different strokes for different folks. So don't give up faith. You will find a therapist out there. Just, and if you do decide that you want to book with me, I will tell people you can buy time and go see another therapist in the meanwhile, but book your appointment. I promise you it'll be worth the wait. Because once you come in to see me, you're only going to need to see me once a month, once every 6 weeks. I'm a firm believer, if the proper therapy is given and applied, you don't need to see a patient multiple times a week. I think that's overkill. It's unnecessary. When you're in an acute state, meaning that your injuries are fresh or they're at their peak of the pain period, if you will, once every 2 weeks at that point is a good duration, because if therapy is being applied properly, you're actually going to probably cause a bit of a setback for a patient for a few days, and you want them to heal from what you've done to them. So by the time they come back to see you, it's like, hey, I've been feeling great for the last 4 or 5 days, or you know what, something just started to come back 2 days ago, and you've hit the nail on the head with regards to the duration. I'm not saying, proceed with caution, but anytime a therapist tells you, I need to see you twice a week for the next 5 months, red flags. That's not the therapist for you. You want to be fixed. You want someone who's genuinely going to want to facilitate your healing. Yeah. That's what I do.
Well, thank you so much. Thank you for joining us here. If anyone has any questions, always reach out to Olivia directly. But more importantly, please always like, comment, and share. These local businesses really thrive with more eyes on them. So please do your part as well. Share them, like them, and support them. But most important, thank you so much and have a great day, everyone. Thank you.
Thanks, Chaunyce.
My pleasure.